Alright, hey YouTubers, just going to review mallet finger fixes for you today. This mallet finger is about 3 weeks post, and I've been wearing some different splints. I want to share with you what I think works, what seems to help. But just as a review of mallet finger, the extensor tenon comes right up here, extensor digitorum communis, inserts here at the PIP, and that's the proximal portion of the middle phalanx, and then the extensor mechanism comes up from the sides and hooks right here, and that helps extend the last distal phalanx up. And so this was a basketball injury. You can see the formation. You compare it to other pinky, you can see the difference. And so this is a basketball injury where the terminal extensor tendon gets attenuated or ruptured. So the idea is we hold it straight, allow it to heal, and then we don't wind up with a permanent deformity that looks like this the rest of your life. And so that's the purpose behind these splints. There's a few different ways to do it, but we need to keep that DIP joint straight the entire time so we have good healing and good function, and we don't wind up with a permanent injury in your finger. And as you can see, I can straighten this all the way, but it naturally still wants to droop a little bit. So it's important to keep it straight so it heals. And of course, coming down all the way like that would really disrupt the healing that's taking place in there currently. So what I found that works now, the reason I have a Q-tip and a popsicle stick on here is because at home when this happens, you need to get it put up there right away. And I found that just a simple fix is to take the Q-tip, bend it in half, and put it right across here. You can even let it sticking out. Of course, we don't want to go across this joint. We do want to cross this joint, right? The DIP. So we put the Q-tip here and simply tape that up, and that's a good fix for a couple days until you can get something better from a hand therapist or doctor or primary physician, wherever you go to. But that's a good little fix. You tape that up and that will protect it. And you want to get that nice and flat when you splint it. So Q-tip works. Lots of guys will use a popsicle stick, but about that long. Put the smooth edge close to the base of the middle joint, right? So you're going to go right here and then tape. That holds that DIP nice and flat when you tape it on there. And that's, you could use that the entire time, but it would be a little cumbersome to tape and untape, and also a little uncomfortable. The wood would get wet and your finger would get a little macerated. So not a permanent fix, but very good temporary. Same with the Q-tip. You may not have a popsicle stick handy. Get a Q-tip. That's what they're used for. I use a little McConnell tape with it, and that works pretty good. Now this little guy is a custom fitted orthosis that I built for my finger, and you can see when I get in there, it allows me some PIP or middle joint flexion, which is good, but when I tape it, see that nice fit? I have that nice extension of the DIP, and a good fit, very comfortable, good fit, little tape on there, and I'm good to go. I can take it off and clean it and just simply retape it, and it's you don't really notice it on there. It's actually a pretty good feel. Move that around, work with it. That's a good fix. I like to keep the end a little bit long, but not too long. If you go too far on the end, you can't type. And so, but long enough to certainly protect it. So that's a good way to manage it. The other splints that I have here, this is the most common, is a stack splint. I can't see the size on it because I trimmed it because it was too long for my pinky. But stack splint is probably what you're going to get at a doctor's office or the ER. These guys, you just tape down like that. You can see that holds it up, but still allows me to bend at the PIP, or middle joint, but holds the DIP straight. These are cumbersome, hard to wear. You can't type. I don't like them. If you've ever had one, and I've put these on hundreds of patients, but when you actually have to wear one, they're not that nice. So, will they protect it? Yes. Are they stable? Yes. Are they kind of irritating to wear because you can't feel it in your finger? Yes. And we have to wear it 6 weeks to 7 weeks you know, why not have something you like a little bit more, like the custom one or an oval 8. Now I've got a couple oval 8s here, and I want to show you how they go on. If you do decide to go with the oval 8s, you have to get the right size for them to work. Now remember, with the oval 8s, they have to be put on correctly. The idea is 3-point stabilization. The bottom 2 stabilize the end joint. Now with oval 8s, it's kind of tricky. You got to remember there's a side that's bigger and a side that's smaller. So obviously the bigger side goes proximal towards your hand when you put on. And sometimes they feel too tight, like they won't go on. You need to lift the finger up like so and slide that finger on, and you can see DIP stays relatively straight, and I'll go through the day and hardly know that's there. If you decide to go with oval 8, you need to get it sized. Don't just order a size off the internet and hope. There's a lot of sizes that won't work. Now this is a size 6. A size 5.5 is missing, and then we have a 5, but you can get these in half sizes. And so if it's not the right size, it's not going to work. I'm going to show you this is a size 5, which is a little tight, and see how hard it is to get on there. Now some people like them really tight, because then they're not going to come off. The problem with too tight is eventually you have skin breakdown and maceration. It's a little hard on the finger. But right after the injury, I recommend the first 2 or 3 weeks something pretty tight, so you're not getting a lot of motion there. You get a lot of motion there, and it's not going to heal quite as good as you want it. But that's number 5, and you can see it's tight, and it's actually quite comfortable. My finger is a little bit red, so I prefer the 6. I've been wearing those. The problem is if you put these on a glove or something, lots of times they'll slide off, and then you have your finger sitting there out of the brace, exposed to bend down, which you do not want that to occur. So that's the number 5 right there, and this is the number 6. So before you just order one of these off the internet, make sure you get them sized. Go to a hand therapist. You could go to an ER. He may send you to an orthopedic surgeon, and then he'll send you to the hand therapist, or you can just somehow get in contact with the hand therapist directly. They should have these. Whatever works. Try and get sized before you buy them. That's the main thing. Or you can buy multiple sizes and see how they fit. But again, this is a 5 and that's a 6, and that's on my pinky finger. So also want to talk about when you maybe need to consult a doctor for sure. If you do this at home and you're just drooping a little bit, more likely than not you've stretched this tendon out, maybe a bit of an avulsion fracture. The treatment is to extend it. Now if there's a large bump back here and it's a full avulsion, you may need surgery. You better go get it an x-ray and go consult somebody, a doctor that can do that. But I would recommend, if you got a little droop here, you can do this fix yourself. Just find a way to get a good splint that holds it in extension. If you do that, you shouldn't have a problem with mallet finger. If you do, and don't do anything about it, if you have a mallet finger injury, which are very common in sports or activities, and you don't do anything about it, this will permanently be drooped down like a mallet. So any questions? That should do it. Thanks.